We're going to talk about the respiratory system for the next few teaching sections. This is chapter 23 in your textbook, and starting out basically an overview of the functions of the respiratory system. Many of them you probably, if I ask you to list them, you'd be able to come up with several of these, but a couple maybe you didn't realize the respiratory system was doing that for you. Certainly provides air to and from the lungs. That probably would be the first thing that you think of when you think of the respiratory system, because you breathe in and out. The other thing in terms of the design, as far as number one is concerned, is the design of the alveoli, which we'll talk about, actually has a huge surface area. So it has provides extensive gas exchange surface area between air and circulating blood. So the gas exchange area is actually the alveoli, which if you took them out of each lung and spread them out, they would cover about half a tennis court in terms of just your get an idea of how much surface area you have in your lung fields, the two together. Then protect respiratory surfaces from outside environment. The area where great problems can happen, like pneumonia, etc., is the alveoli, the area that's deepest into the lungs. So many things, particularly in the outside, the nose, the mouth, those things that we'll talk about are for protection, because you have to breathe in air. You have no other choice. And there's a lot out there in the air you don't really want to breathe in, but you have no other choice, as I said. Produces sound, certainly between your sinuses, the air coming in, and your vocal cords are the big piece of it. But there are all you have to do is listen to maybe me sing, and then listen to a trained opera singer sing, and realize that sound is not the same among all of us. So producing sound is more than just your vocal cords. And then participates in olfactory sense with the brain. So certainly the respiratory system, along with the cranial nerve 1, the respiratory system brings in the raw material for olfactory. So functions, quite a few functions for the respiratory system. What we do with the respiratory system is we divide it up into upper and lower respiratory system. If you've ever had a problem with your respiratory system, your doctor probably said you have an upper respiratory infection, or you have a lower respiratory infection. So this is not only your anatomy book chooses to divide it up this way, this is the way it's done in medicine. Upper respiratory system tends to end at with the pharynx. So the larynx tends to be the dividing point between the two. Many times the esophagus will, or not the epiglottis, will be part of the lower respiratory system. But upper respiratory system, what happens here is this is where the filter warms and moistens air. That again, part of the function of the respiratory system. You have sinuses. You have your frontal, your sphenoid, your ethmoid, and your maxillary sinuses. These are lined with mucous membranes. That's and that actually drains into the nose cavity, and also to the nose cavity and the throat. And what happens is this lightens the skull, and also warms and moistens air. The nasal cavity produces mucus, again filters air, and also for olfaction, so for smell. Pharynx is a passageway for air and food. And then you have on the right side your epiglottis, and the overarching function of the lower respiratory is exchange of gas, so getting the gas down into the lung fields and the exchange of gas. Epiglottis, that covers your larynx during swallowing. The larynx is the air passageway, prevents food and drink from entering into the lower respiratory system for the most part. And then this is where your primary organ of voice production. And then you have your lungs. The lungs you have on either side of the heart. It's in the mediastinum, thoracic cavity, and the heart and the lungs together are what make up the mediastinum, that cavity. And what lungs do is the place of gas exchange. This is what the alveoli are. Trachea, this connects to the larynx and then will lead to each lung. It's the trachea till it bifurcates. When it bifurcates at that carna, that V, then it becomes the primary bronchi. Bronchi will bifurcate and become smaller and smaller, less connective tissue, less smooth muscle until the bronchi become the bronchioles. Bronchioles and I was going to say bronchioles, which is kind of the way it's pronounced, but that's a mouthful. And then branch into the alveoli. Alveoli is where the actual gas exchange takes place. Muscles of respiration, the intercostals and the diaphragm. Now, other muscles can assist, but the primary muscles of respiration are the intercostals, both internal and external, depending on whether you're talking about inspiration or expiration, and then the diaphragm. The diaphragm is the one that starts it all off. Starts it off by contracting and moving up into the thoracic cavity, moving up toward the lungs, and then relaxing and then moving back down again. That changes the pressure in the lungs and allows for there to be a pressure gradient to actually bring air in and out again. And I think I said that backwards. Contracts and moves down. We'll get it. We'll get it when we talk about inspiration and expiration. The micro layer of the respiratory system is a mucosal layer. And I think most of you are familiar with mucosa because you learned about it in the digestive system. We think of mucosa as a certain design. You have a basement layer of connective tissue, and then you'll have specific cells attached to that. Sometimes you'll have some smooth muscle, which many times happens with regard to mucosa. And as the name says, mucosa is always going to have a cell that can create mucus, and that's definitely true of the respiratory mucosa. It's very interesting. A lot of times people enjoy this because it's so obvious. The design is for the benefit of what the respiratory system does. And at the top of the top image, the kind of orangey one, and that's not exactly the right color, it's stained that color. You have the cilia that are found on the surface of the pseudostratified ciliated columnar cells. That's a mouthful. Those pseudostratified, so pseudostratified, remember, is the design that looks like it's layers, but it's not. Column-shaped cells that have goblet cells embedded. Goblet cells for mucus. And also serous cells for providing a liquid that has lysosomes in it. Lysosomes are have enzymes that actually can neutralize those pathogens that might come in. So you have a liquid layer on top of this cilia of mucus, and then also this serous fluid with lysosomes in it. The cilia actually beat the air comes in, the cilia are beating the air back out again, but actually it's not the air that it's beating out, it's beating out any particles that are too heavy that will actually get caught in the cilia and beat it back out again. And the idea is that those particles will get trapped. They will get moved out if possible, but they'll get trapped in the mucus, and then eventually the mucus can come out, which if you've ever had any kind of respiratory infection, you know this happens. This mucus comes out. The individual makes this noise to get the mucus up and then eventually comes out again. And I'm sure you know what I'm talking about. But that's the design of the mucosa. And again, a wonderful graphic image of how design is for function. The first part individually that we'll talk about is the nose, because that's the beginning of the respiratory system. It's where air wants to come in. It may not be where air always comes in, but where it wants to come in. It comes into the nose because through the external nares, the nostrils. The nose is divided into two cavities by the nasal septum. Generally, the nasal septum is somewhere in the middle, but some people have a deviated nasal septum. Sorry, I just put my fingers up to my nose, and I realized that might affect your ability to hear me. But some people may have a deviated nasal septum, and if you think of somebody you know who did, then you really know what the septum is. But that's a good plan too, because many times throughout the day, one side will be occluded, so stuffed up, whereas the other one won't, and so at least you have one side to breathe in via. The nose has mucus lining in it also to actually for the same purpose as the respiratory mucosa, to moisten the air, to trap particles, and also the chemicals of smell are picked up by the olfactory nerves because they are dissolved in liquid. That's how the olfactory nerves can pick up. It's pretty amazing. I think it's your textbook says even 4 particles of a chemical can be picked up by the nose and identified if that in fact is what the brain is paying attention to. You can see the frontal sinus here in the frontal bone. You can see the olfactory bulb and tract and its approximation to the brain itself, the cerebral cortex. You have the sphenoid sinus. Sometimes that's more difficult to see because it's more internal. You have these turbinates. Your book calls them conchi or conch, whichever way you want to pronounce that. And you have the conch, or the rigid, or I guess the extension. The turbinates are the valleys. And so you have superior, middle, and inferior of both the turbinates and the conch. I think I've talked about everything that's on this one because we have another nose one. Here's another nose one. This is a pretty classic image. You have, I don't believe it's figure 13.2 in your book anyway. I took this from somewhere else. But you have a very, very similar image in your book. This is an image that it's good to know most of the anatomy on this. So where the sphenoidal sinus is, where the pharyngeal tonsils are, for a test that will come up. So this particular image could show up on your test, and there will be leader lines asking you, what is this part? So it's a good one to put a flag on and say, I should know these parts. Good for lab too. The paranasal sinuses, we talked about this a little bit already, but here you see an image of them. You have a nice image in your textbook also. Sometimes I use images that are not from your textbook only because I want to fit them all on one page. And what you have are your frontal sinuses. You have your ethmoidal. They're actually little cells, the ethmoid. There are numerous little cells. It's actually, when you look at the whole bone, they're much bigger than you might think, looking at them from one view or another. Sphenoidal, and then your maxillary sinuses. Again, anybody who's had sinusitis really knows where all of these sinuses are. Their job is to lighten the skull, act as sound chambers, resonant chambers, and then produce mucus that drains into the nasal cavity. They don't, they don't produce mucus just for the fun of it. It's part of how they operate, producing the mucus. Also, anytime you see mucus produced, it's usually as a defense, non-specific defense. We'll pick this up on the next one.